All right. Well, thanks everybody for joining us today. So I'm told we don't have a chat. And as I try to fix this, maybe we can take just a minute for ourselves to think about where we on which lands we sit and what that means in terms of informing our work. I know that I've learned a lot from Indigenous colleagues and friends, and that has led me to be here today and to do a lot of work on sustainable healthcare. And so maybe instead of sharing the chat, we'll just have a bit of a thought for where we reside. Next slide again. So this meeting is this webinar is recorded, and we'll be putting it on YouTube. And I'm really hoping that we have a fruitful discussion here as to the future of sustainable healthcare and planetary health in Canada. We have a lot to share, especially after what happened at COP30. Next slide. Next slide. Feel free to use the Q&A section for any questions. I will be directing them at some panelists as we go. And if you'd like to speak closer to the end of the webinar, please feel free to raise your hand if you'd like to contribute. Next slide. And back to you, Courtney.
Great, thanks. So thanks to everybody for joining us. I'm joining from Chief Dragi's territory, the traditional lands of the Yellowknives Dene and the North Slave Métis. And as Will said, I have certainly learned as much about planetary health as I have from Indigenous peoples as I have from my friends at the Lancet. And what's been interesting is watching the global part of planetary health change so quickly over the last couple of days. So when we convened this panel, we were really set to focus mostly on COP30 outcomes, but we decided to incorporate some of recent developments because I think it informs the discussion of things on the global stage. So as many people know, Prime Minister Carney gave a speech at Davos, the World Economic Forum, that received a standing ovation and has been in some circles heralded as potentially a defining speech of the era. And during it, he essentially said that the multilateral institutions on which middle powers relied, the WTO, the UN, and the COP, so the very process we're here to talk about, the architecture of collective problem solving is under threat. And he called for middle powers to join together in order to cooperate and have increased collective power in a world that is increasingly defined by large states using economics and the potential even of military force to achieve their objectives. And I think that it's a very interesting place for us to be in a conversation that is around climate change and the threats it poses to health and health systems, because it starts to bring us into more of a polycrisis lens, where instead of solving for the problems that climate change poses to health and health systems, we start to take a look at all of the threats that we face in more of a disaster response health all hazards lens, which isn't the way I've traditionally looked at this, but I think might end up being a way that we can grapple with that with the frameworks within the health community that we already have. And I'm really curious. Jeff Totkin and I wrote a paper with some disaster medicine specialists. John McGraw is convening a technical panel on emergency response for Accreditation Canada. And of course, we have Senator Rosa Galvez, who, as one of our leading senators, is really forced to grapple with all policy issues that cross Canada's plate. And so I'm very interested to hear what they have to say as from more of a Western perspective. And of course, Shannon Waters comes from an Indigenous perspective, where health security tends to be looked at through generations in a way that Western ways of thinking don't always acknowledge. So we'll start with that today, that lens, and highlight another report that came out last week that I feel like is the report in some ways we've been waiting for a long time. It was produced apparently by the security forces in and intelligence groups in the UK. Originally, it was squashed by the government in the fall. They didn't want to release it. And then Freedom of Information request resulted in its being released last week. And apparently, according to the Times, it's not even the full version. It's a bit of a redacted version. So I think that it does a much better job than I've ever seen anywhere else at describing not only climate change, but impacts of biodiversity loss to national security. And I like this pathway a lot. I hope that copyright laws allow us to use this image in our work because it really outlines how degrading ecosystem functions show through to physical and biological impacts, which creates human security risks and international risks. And in a world that doesn't always like to take the feedback loops of complex adaptive systems into account, I really think that this approach does. And so, to my knowledge, we've never produced a report like this in Canada. And from just the sheer number of times I've seen it shared on LinkedIn in the last couple of days and what we know about climate communications, where people really need to understand what the actual threats to their daily lives are in order to care and for the issue to be politically salient enough for decision makers to take notice and act on it. I think that this is something that we really ought to be taking into account as we move forward. Unfortunately, what they showed was kind of worrisome. I did not like these things that they said. They said there was a high risk of global ecosystem degradation and collapse that threatens the UK national security and prosperity, moderate risk of cascading risks to include geopolitical instability, a high risk that critical ecosystems that support major food production areas and impact global climate, water, and health cycles. Impact the UK. They pointed out that all ecosystems are at risk. And some of this can happen kind of soon, starting in the 2030s, and that we all may be affected by ecosystem collapse across other borders. So, how's everybody feeling? It's still morning where lots of us are. How's your belly? How's your spirit? So I want to just acknowledge, as we all read that, and it's bad news, that this is bad news. And I think it's important that we acknowledge that because otherwise people just tend to look away and think that maybe they're the only person who feels worried by information. And I think just saying it out loud acknowledges the common worries that we share and brings us into the community that we need to solve the problem. So that's what we're going to do now. No pressure, friends. And so, as we put this into the context of the COP30 conversation, there was an actual adaptation plan that came out of COP30, which we've never had before. It's always been the sort of poor cousin. And there's just a couple of things that I want to pull out from the special report. So, number one, this is the executive summary of the technical report. And something that we will be talking about later is climate and health secretariats. And you can see in point number 2, I have fetchingly put an arrow next to the sentence that says progress is contingent on establishing dedicated climate and health units within ministries to drive implementation, robust cross-government coordination mechanisms, and formalized accountability to ensure health is prioritized across all sectors. And this is with regards to climate change specifically, and that the means of implementation exist. So this is really what we're getting at with these sustainable healthcare secretariats. And as Will did a survey across the country, and we've had more and more conversations, we think BC is kind of ahead of most of the provinces in figuring out how to do this, which is why we decided to focus this panel on BC. Other provinces are in various places. We believe that these secretariats probably should be within the Ministry of Health with good linkages to other places and likely need to tackle mitigation and adaptation and also biodiversity and more planetary health risks. So to have a good chat about this, we're going to bring in our friends, Dr. Adam Thompson, President of Doctors of BC, Dr. Shannon Waters, who is the Deputy Provincial Health Officer and the first Indigenous health officer of planetary health, as well as Jeff Totkin, who's doing his PhD on emergency management in the climate emergency and is currently a manager of the health emergency unit in Central BC Interior Health. So I'd like to start, and we're going to see if we could do this in a bit of a flowing way. I have questions for both of you, but it would be or for all of you, but it would be interesting if we can actually do it with people kind of raising their hand to speak. So if everybody can unmute who's on this panel so that we're kind of ready. And my first question is for Adam. Adam, so you're a doc in BC. You do clinical work as well as being the new president of Doctors of BC. What impacts are you seeing from climate change on health and health systems where you are?
Yeah, thanks, Courtney. So I'm a family physician in the Comox Valley, which is on the east coast of Vancouver Island, on the traditional unceded territory of the Comox First Nations, and I've been a practicing FP there for 15 years. Within our community, there's some clear, blatant local observations of climate change. We're well known, our local landmark is a glacier, which has been shrinking and was almost absent at the end of last summer. We have a ski hill that's failing. And this last summer, we saw major forest fires on the island where historically we really haven't seen any. There were some major forest fires down near Port Alberni. And that's really the biggest impact that we've seen, I think, in terms of the health impacts has been the smoke impacts with those with respiratory illness, just diabetes, cardiac disease, who are, struggling to go out, getting flare-ups of their illness. You're also seeing amongst younger patients of mine coming in with anxiety, and some of that is driven by climate anxiety, frankly. And then the socio-economic impacts, which have an impact upon health. So those who are of low income and what have you, whose employment depends on issues like the ski hill functioning, or issues around food costs or heating issues when we've had extreme cold in the winter, which is unusual on the island. These are the sort of issues that we're seeing day to day on the front line in healthcare. Aside from that, however, as a physician who works and networks with other grassroots physicians, I'm still seeing other physicians not really seeing this and grasping it as an issue or knowing where to go and what to do to advocate. And I do feel that physicians have a peculiarly special relationship with society and are in a particular position to advocate for issues through the healthcare lens that might improve everything for society. So that's what I'm seeing as a family physician, and I can speak a little bit later as my role as president and how that might impact and what I see.
Yeah, those are common things, and certainly every survey we've ever done of docs in Canada, and there have been a few, basically say that most people don't know what they don't know. And every year, a few more people are at least aware they don't know things, but we're a long way from where we need to be in terms of people actually having a sense of what the risks are, and what to do about them. And most of the evidence we have around that shows that there's a giant gap between knowing about the risks and knowing what to do about them. And so we really need to focus on both. Um, Dr. Waters, I'm curious. So we were all so excited when you were appointed the first Indigenous lead for planetary and water health in BC. How's it going?
Yeah, no, thanks for that. So I'll say Ait Squale. Oh, can you hear me? Yeah.
Yeah.
Yeah. So good day, everyone. Yeah, so I am, and I believe actually it's also the first position of planetary and water health across Canada. I don't know that another position exists as such, and I really do want to acknowledge my colleague, Dr. Daniel Bain-Smith, and Dr. Bonnie Henry, who were working with each other in leading up to the time when this position was created. And Danielle, who's Echo Dene from Fort Nelson First Nation here in BC, an area like many across the province, very impacted by climate change and massive fires that required evacuation in the very beginning of the summer last year. Really worked to bring forward the need for a position such as planetary and water health. And Danielle really advocated that would be well filled by someone who was First Nations from BC, who had had connection to lands and waters for generations upon generations. So I really acknowledge that. And I started in this role in July of 2024, and many things have changed, as you've described, Courtney, even in the last week, never mind the last few years, with regards to this landscape. I feel incredibly privileged that I get to focus on this area in my work. I was previously, most recently, a medical health officer in my own home territory, and I've worked with Adam Thompson before when I was at First Nations Health Authority as a physician lead there. But I really found in terms of our perspective of being in relationship and protecting our home territory. And I really just want to acknowledge Courtney and that document you shared of the recent report that was released because of a information, push to get that out there. That one of the things that said there, I think, on the beginning is nature is the foundation for security. And nature is the foundation for security. The ecosystems are our health systems. And so that's really what I'm trying to push in this role. And I have a specific role in water as well, and really looking at our watersheds. And it is a challenge right now within this political climate and economic climate because there is a pull back from doing things that are kind of long-term strategies. And I think we need to keep those flames alive right now of how to do that. And so looking at watersheds and healing watersheds as an intervention for the planetary polycrisis is something that I'm speaking about within the tables and circles that I get to sit at. And I'll just, for instance, name one, which is the BC First Nations Water Table, where I was sitting at a meeting yesterday. And how do we bring forth these ecosystems that we rely on that have supported us for generations upon generations, and support them in this in the challenges we have coming ahead. So it is a challenge, but I also feel it's a tremendous privilege, and it's the most important work I feel I could be doing right now for who we have here and who's coming in the future as well.
Well, we're so glad you're in that role. I think it is amazing, and as it's sort of rolled out, the fact that water is in the title, I think is even more important than I thought it was when you were first appointed, because it's so place-based. I think people connect to it in a way that, talking about greenhouse gas emissions, it doesn't really work. So shifting to a water security argument, I think could be really powerful in a way that's sort of more wholehearted than we've done in the past. So Jeff Totkin, the last time I saw you in person, you looked more tired than anyone else I have ever seen other than a neurosurgical resident. It was the beginning. I was just like, whoa, who's your attending? It was sort of the beginning of wildfire season, and he's in charge of scooting people around and managing emergency services in BC, as well as doing his PhD. So let's talk us through these slides, Jeff.
Yeah, thank you very much, Courtney. And just want to recognize and acknowledge that I'm calling in today from the traditional ancestral and unceded territory of the Sailks people here in what is now known as Vernon, BC, and just a real pleasure to be here. And I recall during that time we had together, it was during the Jasper wildfires, and so we were having a conference on mental health and wildfires and climate change, and we were under a blanket of smoke in Edmonton, and so that was an interesting aspect. So in terms of the health system impacts of climate emergencies, I think folks around this collective virtual table are probably well aware within the BC context. So when we think about interior health, and so this is the area in which I'm situated, there's a lot going on as it relates to the response. And so let's just focus on response for a minute. And as Courtney mentioned, there's obviously adaptation, mitigation, preparedness, where we see a lot of energy expelled. And I use that because, as folks know across the country, healthcare capacity is a challenge, and it's often about what is the issue for today? How do we solve the problem for today, over capacity being one of those. So we're expelling a lot of energy as we respond to these types of events. And so just to put it into perspective, 395 employees within an organization of about 18,000 folks were affected and were involved in the wildfire response. And so that doesn't necessarily capture, that's those that are working on wildfire response. It doesn't capture those who are personally affected by evacuations. So orders and alerts, we're looking at over 7,000 hours spent. So we think about some of the fiscal realities of of the health system today, it's a lot of time that is spent, and this is 1 year. This is within one fire season. 988 long-term care residents were evacuated. So that starts to demonstrate it's not just the employees, there's a magnitude, and Dr. Thompson spoke about this, of impacts, but it's also really impacting those that are vulnerable. And we've seen a lot of evacuations, and these are frail and elderly residents. Sites evacuated, 10. So again, there's a lot of energy that goes into this, and not only the sites that are evacuating, but the sites that are receiving as well. And so what I want to point out here is there is a heavy impact on those in a rural and remote community context. And so we think about the theme of health equity. Those that are most impacted by this commonly are those that live in these areas that don't necessarily have the same type of systems or the same types of services. And so they're being displaced and often moved to communities that are not their home community. And these are oftentimes quite unfamiliar communities to them. The polycrisis. So now it's not just dealing with one crisis at a time. As we know, of course, this is disrupting the health system, and with fire comes smoke, comes oftentimes comes heat. And so really this is what we're seeing more of, is this polycrisis. And this also, of course, brings about challenges, not just in a response context, but challenges for Indigenous communities, and really what are some of the colonial aspects of emergency management. So that's been a lot of work to be aware of how it is that we respond to events, not just within in the health sector, but really across the health system and across sectors. So the tools that we're using, how can they be adapted to be more informed and to drop that colonial lens that they often have? And then, of course, the preemptive evacuations within communities. So it's not just getting out as quickly as possible, but at times there may be one way in. And so those communities are having to leave sooner. And oftentimes that creates a challenge because during alerts, the health sector may need to leave the community. So what happens to the people within the community as it relates to health? So maybe I'll start off there, and perhaps we can continue the discussion.
Yeah, so many of the things that you said, I recognize from, our evacuation here, or other times, because when you evacuate a hospital, actually we still needed to run the emergency department for the wildfire workers. And I had never thought through all of that before. And even now, after nursing stations evacuate, I'll end up talking to a paramedic who's never been there before, who was scooted in, who doesn't know the system. And it's like, can I text you the EKG at the nursing stations? And so it's like you need contingency plan for contingency plan for contingency plan. So, I'm going to be watching Shannon and Adam. Just put your hand up if you'd like to respond.
Nothing particular to add, Courtney. I mean, I think this is the ongoing issue that we have provincially, is how do we tie all of this together to all of the various representative bodies within BC that can link in a way that is meaningful. It sometimes feels that when I think about this, that we're working in isolation and in silos to address the same problem. And I want to understand, my theme of presidency is about building community, and how do we build a better community within BC, linking everybody that's affected and also interested in addressing it better to solve the problem.
Yeah, and maybe what I would just mention is the arrow that I took a picture of it where progress is contingent on establishing units within ministries. So yeah, one of the things I really feel strongly about in my role is that I am trying to spend as much of my time with people who are outside of what we typically, not necessarily from an Indigenous worldview, let me say, but from a Western worldview, what we deem as health or health care. And so if we're looking at our ecosystems as our health systems, like I'm trying to spend as much time with people in water, land, and resource stewardship, within forestry, within agriculture, and really having some of these conversations about how we do holistic decision making. So you mentioned water was within my title. One of the pieces of Western legislation that is something I have power under in this role as a deputy provincial health officer is the Drinking Water Protection Act. And that is really looking at protecting water for human use, not really protecting water to help keep our ecosystems, our rivers, our lakes, our aquifers, the forests, that depend on the water within the forests that keep water upon the landscape. And so such an important thing with what's going on with our forest fires, the amount of drought that we're having in this province. And so how do I work with other people in other ministries to have more collaborative discussions about how we make holistic decision making amongst what's typically been viewed as health, but also forestry and water, land, and resource stewardship and other ministry partners for how we keep the whole ecosystem working so that we can have rivers running in the summer, that we can have water within the soil and in our trees, so that we're not looking so much at how we go from season to season. And people are already worried about the season, as we've had experiences coming into the summer, about where we're at in terms of our snowpack right now and our stream flows. And this is already, ironically, after we've just had very high rains and flooding in parts of the province and just across the board in Washington because of extreme rain and atmospheric rivers that we experienced just a few weeks ago as well.
Mm-hmm.
And Courtney, perhaps what I'll add is when we think about the polycrisis approach, and Dr. Waters just mentioned it, where the seasons are becoming much longer, and there isn't necessarily a stop and a start, and we just saw that with floods in December. And so within that polycrisis and really crisis leadership, I think that's a really important piece to this, is thinking about how we train leaders within not just the health system, of course, but across sectors. How are we training leaders to cope with crisis, with prolonged crisis, with polycrisis, and what is that secret sauce so that they can be successful in their roles? And to that end, the slide that you're seeing right now is a scoping review on health and climate change competencies. And so this is one piece that I'm looking at in terms of my academic work. And the question is, how are our folks competent? Are they competent around the climate and health education? And so what I found through this is that it is quite disperse in terms of the education that does exist. And so when we think about training future leaders, training healthcare workers, and again, not just within the healthcare sector, but beyond that, how are we equipping folks to be ready for this challenge? And so as you can see, this was a scoping review that was done across high-income countries. And what you're seeing is that it is quite porous in terms of a common set of competencies that is being reinforced. And one of the great challenges of this is that people don't necessarily have the time. This is often something that is optional for them. And so when we start to look at curriculum within professional spheres, whether it's nursing or medical schools, this is something that doesn't necessarily or can't necessarily be elective anymore. This is something that people need to be aware of, and that's a part of the advocacy piece. And so, as you can see, the duration of interventions most commonly is one session. So, are we really equipping folks to understand the scope of climate and sustainable health through one session. This is something that has to be repeated. It's something that we can start to leverage things like simulation. I think ultimately this helps to ground leaders and starts the conversation about crisis leadership. And so that's something that I think is a really important piece to this. When we think about health security, what is health security, and ensuring that people are aware of what these themes mean, what they mean to them, and how it's going to impact them when we start to look at response.
That's wonderful. So we're just coming to the last couple minutes of this panel. And in that vein, and I see your hand, Adam, I'm curious because we need a positive narrative in all of this. And when I think about how we're going to help people cope, I think we need to invite them to take care of themselves, take care of their community. And I think focusing on well-being, using a planetary health lens with well-being as the overall outcome, gives purpose to people's work in a way that can support some of it. And I'm curious about just quick closing thoughts about that from our three panelists.
So, I mean, just to pick up on what Jeff was saying, SFU, Simon Fraser University Medical School's new campus is going to be starting in August this year, and they're going to be integrating planetary health, sustainability, and climate resilient care into their curriculum. But for me, that's a little late when we're talking about leaders of the future, and we're looking at the UK study that things are going to start failing in short order. I think we need to have people in leadership positions, such as myself, who are able to advocate and network with other physician leaders to start to tell this story and to start to work with others to make them realize that we do need to understand the challenges that we're experiencing in planetary health and how we need to deliver solutions for climate resilient care. And I would want to do that across the PTMAs, the provincial and territorial medical associations of Canada, with the Canadian Medical Association working as a facilitator to achieve that. And I think that must be our future.
Gosh, Adam, gold star. Shannon.
Sure. I would say a couple things. So first off, I would say that typically within health, we sometimes mention mental health. We usually talk about physical health. And for myself, as a Hulkmeetinum woman, we look at health holistically. And so that also incorporates emotional and spiritual health. And I think one of the things I'm looking at is we need to incorporate more dimensions into the work that we're doing right now. And there is a lot emotionally, mentally, physically and spiritually that I'm affected by with this type of work that I'm doing. But when we bring in those aspects, and I think of the region that Jeffrey's in, where there was a very important emergency management body of work that the Silcotin First Nation was involved with, and they really highlighted their spiritual relationship with salmon. And they looked at the report from a centering salmon perspective. And if we look at and build our responses in incorporating those emotional, mental, spiritual, physical aspects, I think, those are the types of things that we're really going to have to nurture during this time. There are a lot of challenges coming ahead. They seem unprecedented, but I also know, particularly as Indigenous peoples within what is now called Canada, we have dealt with, really difficult times in the past. And it was through those relationships and nurturing ourselves and relationships with the ecosystems that we belong to that, built us and have sustained us for generations upon generations, thousands and thousands of years. And I really personally draw on that type of strength and just remind us all that these things are here for us. It is a scary time, but we can be there for our environment, and our environment is also there for us. So I just really think incorporating those multiple aspects and really drawing on them and nurturing them during this time.
I love it. Jeff?
Yeah. Some of the work that we've done has been focused on the Emergency Operations Center, so very much within that response context, and ensuring that there is a focus on psychosocial safety and more recently cultural safety. But that's really, I think, one piece. And so from what I see, from what I gather, it's really that importance of promoting cultural safety and psychosocial safety in the day-to-day work. And so it doesn't necessarily help when we advocate for this. There has to be that piece, the day-to-day, the interactions with patients, the cultural and psychosocial safety of patients, of staff. And I think that through that, what we're going to see is we're going to see a shift in how we view emergencies, how we respond to emergencies. And that psychosocial cultural safety piece, it's so important from not just an emergency response perspective, but in the day-to-day work, because the health system here in BC and in other parts of Canada is going through immense change. And so that's creating a very uncertain world at this point. And that, of course, is exacerbated through these emergencies that are coming up. And again, that year round, what we're seeing. So I think that's a really important piece. We heavily advocate for increasing that psychosocial and cultural safety aspect within the Emergency Operations Center. But I think beyond that, it's a day-to-day approach and ensuring through the policies and what we can do within that emergency plan landscape is we can really promote those concepts of psychosocial and cultural safety.
This just warms my heart. When I was training as an emerge duck, you were basically not allowed to talk about your feelings, and you were kind of in a cowboy culture, rock'em sock'em, and that's just not what I'm hearing, Jeff. So, we've made some progress towards the world that I think Indigenous peoples have been showing us. And to have you here, Adam, as the top doctor spokesperson in BC, hearing the conversation, putting it into your sort of foment for what can come out this year. I'm just really grateful to all of you for the work you're doing and for being here. So thank you. We're gonna move on now to what may end up being a Rock'em Sock'em session on decarbonizing healthcare, as Will takes us through what happened at COP and what ought to happen now. So, Will, I'll try to be a really good slide advancer.
Thanks. Thanks, Courtney. My name is Will. I'm the Director of Strategy for Power Wellbeing, and I'm an engineer, and I focus all my efforts on decarbonizing our healthcare systems. Next slide. This guy, William Thomson, is the British mathematician, physicist, and engineer, and he said, if you cannot measure it, you cannot improve it. And then 100 years later or so, this guy, Peter Drucker, management guru, said, if it cannot be measured, it cannot be managed. And this is super true for healthcare systems decarbonization. In Canada, we don't have a healthcare systems emissions baseline. And we've asked Health Canada if they're responsible for measuring greenhouse gas emissions in healthcare. They said, not our mandate. And then we've asked ECCC at COP30. And this is what I'll talk about. But before that, next slide, Courtney and I last year worked on a desflurane phase-out campaign as a starting point for decarbonizing healthcare systems, because we know that desflurane is a super polluting and acidic gas with alternatives that are cheaper and equal for patients and just better for climate. And so if we can start rolling the ball on this as a first solution, then I think we can generate momentum and excitement about other things in healthcare systems decarbonization. In about April, we realized, oh my God, there's already 100 hospitals that have phased out desflurane, and then we're at 127. Next slide. There's 3 provinces and territories that have phased out desflurane already. And if I was a betting man, and if you have any friends in Nova Scotia, maybe give them a call, because I think Nova Scotia is pretty close, although British Columbia is, I think 4 out of 6 health authorities at least have phased out desflurane. And I had heard an October phase out deadline. I think there's a lot of work happening there. Next slide. And this is just one example of how we can decarbonize our healthcare system. But what's really important is, as a start, is having a healthcare systems emissions baselines. Singapore did this, and they published it recently. And I was part of it in 2024 when we started working on this in Singapore. And it took about 18 months, maybe a little bit more. And I don't want to discourage anybody, but Singapore is no longer using faxes. And so if we want to have a healthcare systems emission baseline in Canada, we need to get going on this. Next slide. Singapore is not the only one. The UK has a pretty solid emissions baseline, Australia, China, Japan. Next slide. Canada has one too, that was developed by Dr. Andrew McNeil out in BC. The data is from 10 years ago, so we need an update to this. And it was a really good um, catalyzer at the time to get us moving, but it was based on healthcare spending data. So in terms of accuracy, it's a little bit like a finger in the wind as to where the emissions are coming from. Not to discredit the work of Dr. Andrew McNeil, but we need way more collaboration between provinces and territories in the federal level to know precisely where our emissions are coming from. Next slide. Um, we have been calling on this. The Canadian Coalition for Green Healthcare has been calling on this. Power has been calling for this. Cascades, Dr. Fiona Miller at Cascades published this paper that says basically we need more standardization and a way to approach data collection and analysis. And I want to give an example. In Singapore, when we started contacting hospital CEOs and saying, hey, we need your emissions data, they said, yeah, sure, but let us look into it. And then it kind of generates like a spur of excitement and a bit of anxiety around, okay, how big are our emissions? What do we need to do? So the collection is not only, it gives us data, but it also like gets people, moving about this. And I'm curious to hear from John McGraw how that is going to help us accelerate our decarbonization efforts nationally. Next slide. So we had heard from Health Canada that it wasn't their mandate to produce a healthcare systems emissions baseline. So at COP30 in Belém, I had the opportunity to ask a question to Environment Minister Julie de Brussen, and I wasn't sure about my question. And I asked a couple colleagues, like, "Oh, should I ask this question?" And some colleague was like, "Nah, we're here to be friends." And I was like, "Oh, we've been friends for a while now." So I was texting Courtney. I was like, "Should I ask this question? Should I?" And she wasn't answering. And then she just at some point she answered and she said yes. And then I asked the question, when will the government of Canada have a healthcare systems emissions baseline? And to me, that was a really important question because I don't think we don't really have an answer to this already. Her staff chased me after the meeting, and which I was really excited about and hopeful. Next slide. But then in January, I got this letter from the minister saying basically, sorry, I don't have time to meet about this. And I had to sit on this for 48 hours and I was like really mad. But then I sent back an email to the staff and I said, hey, this is unacceptable. Let's discuss in February. So the staff have agreed to meet with me, and we'll see where it just goes. I'll keep you updated on social media. Next slide. Um, Okay, tons of work is happening globally on healthcare systems decarbonization. The WHO and Attach put out this measuring greenhouse gas emissions in health systems guidelines. There's a lot of other decarbonization tools that are shaping up, like the Lancet Med Zero that Dr. Agnes Hansen and Dr. Chantal Rosano are working on. HealthcareLCA.com is another great resource, partly based at Dalhousie, by the way. Next slide. And not to toot my own horn, but if you click again, the video will start playing. Without a baseline, we can't make progress. So with the Canadian Coalition for Green Healthcare and with funding from the Peter Kilgan Foundation and Carleton University, I am working on a healthcare systems solutions database only for healthcare. So if you're a nephrologist, these are the solutions that you can implement in your practice. If you're an anesthetist, these are the solutions you can implement in your practice. And each solution comes with case studies and resources and data on greenhouse gas emission. It is not public yet, but if you send me an email, I can send you the password in exchange for some of your feedback on this. Next slide. And so I think we have a lot of work to do. If your hospital has phased out desflurane, please let us know and we'll add it to the map of desflurane-free hospitals. I encourage you to convene a sustainable healthcare secretariat in your provincial territorial health system. Initiating an emissions baseline, just like BC is doing, is a really great idea to get others moving on this. And of course, you can donate to Power to continue supporting our work. Back to you, Court.
Awesome. Thanks, Will. And I think that this is a place where if we teamed up as provincial territorial medical associations and the Canadian Medical Association, we could really get
Yes.
going. Because what we find is that if you make people are competitive is the bottom line. So if anybody does something, so say BC does an emissions baseline, then we go tell everybody else. We're like, hey, BC, or hey, Manitoba, hey, Quebec. And then once that happens, then that motivates the federal secretariat to do it. And basically, we just need to get on to this kind of a hope and action spiral for this. I think it's very possible. The key part is telling one another, because if you don't tell one another, you don't generate the hope that comes from concrete progress, and then you never build any momentum. So it's one of the reasons why we think we really need to coordinate Canada-wide. Thanks so much, Will. It's exciting. And your PhD project is looking awesome. JP, so all of this work requires support. And so we wouldn't be here doing this if not for the support of JP and the Trotty Foundation. And the climate and health funders are starting to come together to talk about how they can be most efficient with their resources in helping to advance this work. So JP, if you can join us and let us know what happened at COP and how it translates into what's happening in Canada.
Sure. Thanks, Courtney. Can you hear me properly? Awesome. Hi, everyone. Nice to see so many of you online. I'm calling you from the unceded and unceded territories of the Anishinaabe and Algonquin Nation, also known as Ottawa. I'm really happy to be with you today. I'm one of the climate program directors at the Trotty Foundation, who's actually based in Montreal. Before I jump into the convo around the announcement at COP, I just want to do a bit of a follow up on what Will mentioned and a bit situate how we come in this space at the Trotty Foundation. Essentially, about mid 2023, we announced a new approach on our health, or part of a new approach on our health focus area. And actually, I should even take a step back. If you don't know the Trotty Foundation, we've been around since 2000, and we work on science, education, health, and climate/environment. And within health, in mid 2023, we decided to create a health and climate program for over 5 years, really dedicated on decarbonizing efforts in the healthcare system, with a first emphasis in Quebec, but also which led us to work with many others in this space, as I'll mention in a minute. And so we've been since then working with many organizations. I think some of them have been mentioned in the few slides with their logos. I'll mention Synergie Santé Environnement in Quebec, as well as the Association pour la Santé Publique du Québec. We've worked with CAPE, but we've also, of course, worked with Power, with the CMA, with the Canadian Coalition for Green Healthcare, Cascade. So really trying to uh, work with some of the key players in the space, again, from a perspective of how can we reduce the footprint of the sector. And so that also led us to engage with other funders. So Will, you mentioned the Peter Gilligan Foundation, who I think is also on the call today. And so we've been very fortunate to have conversation with the Peter Gilligan, with others in the space, to say, okay, how can we further share knowledge, or also see where we could use some of our funding and resources to improve some of the efforts, such as the ones that Will mention in this few slides. So all of this kind of led us to co-host an event in partnership with Power, with CMA, and also the Globe and Mail in October, just ahead of the COP30, where we held this one-day event on health and climate, really which had a few objectives. The first and foremost objective was to follow up, I think, as someone who had a question in the chat about this, about really trying to bring people together to create that space, actually, for physician practitioners and also the decision makers on to have that conversation around health and climate. And I think that's one of the superpowers that foundation can have, because you know, we can make these kind of gatherings happen. So it was really, really, I think, well received. And the other part of this was really how we could help the foster a spirit of collaboration and breaking down silos. I think, as Dr. Thompson was mentioning earlier on, to really better advance and further advance the planetary health roadmap that so the AFM and FEMAC and Courtney and so many others worked on, including the team at Power. So that's kind of the role that we've played in this space. And the segue to the international funders that I'd like to mention, even at our October event in Toronto, there was someone there from the Wellcome Trust who was in attendance because they had been aware of our effort in Canada to try to create that the collaborative space. And the reason someone from the Wellcome Trust was there is that for the last few years, it's starting again in 2023, the Trust has been in conversation with many international funders. It started at the New York Climate Week, I think, in 2023, and further further deepened the relationship in 2024. And we joined mainly as a kind of a small observer and in the spirit of exchanging information. And we were part of the first moments of that Climate and Health Funders Coalition, which kind of formally announced itself at COP30 with this major announcement. So, what exactly is this coalition? Well, really, it's about 35 leading philanthropies, global philanthropies that are trying to align and expand funding efforts to address some of the most urgent climate and health challenges and really try to unlock long-term investment with their capabilities. So what they did, and actually that came from over a year of discussion, exchange. All this was shepherded by Bridgespan, who was hired to help bring these foundations together. And essentially, what they did, they announced a 300 million commitment at COP30 in Brazil, time to support the implementation of the Belém Health Action Plan. I'll name some of the top priorities actually of this coalition. And again, this was decided after over almost a year of back and forth and conversation about, okay, where should we focus in the intervention? And I say we, but we're again mainly an observer. We've not put funding in it so because we're partly so small and we mainly operate in Canada. But the focus areas are extreme heat, air pollution, climate sensitive infectious disease, and also the fourth one is critical climate and health data for decision makers. I want to emphasize on that last point, and I know I'm out of time here, but we started a conversation about health security and whatnot, and that decision around data was made just before the new administration in the US came in, but it was so critical because, as we all know, the Trump administration pulled out of so many international agreements, but also pulled back the funding from many, like for data centers. NOAA is one of them, but that created a ripple effect and a huge wave of concerns from many of the funders. And certainly for the World Health Organization, who's the Trump administration decided to pull out of. So this was very timely, and in matter of health security, making sure that we have access to proper data, that the scientists, the physician, the practitioners can use that properly. This was like an unfortunate but good timing to focus on this. I'll stop in a minute by saying that among the funders, and the biggest funders are the Bloomberg Philanthropy, SIF or Children's Investment Fund Foundation, the Gates Foundation, IKEA, Quadrature, Rockefeller, Wellcome Trust, of course, and others. We were the only one focusing on healthcare system decarbonization effort from a Canadian perspective, which was quite interesting in the room. That was not the priority of other funders, but I think it generated a few pieces of conversation. The last piece before I pass the mic back to you, Courtney, is like next steps. What are our hopes for 2026 and beyond? Well, I think there was again a question in the chat about like how can we create more spaces for collaboration, and I think that's what we're hoping for. Hopefully, we'll be able to provide a little bit more support for those spaces to pursue the conversation that happened in Toronto at the health and climate event, pursue the efforts of putting in place in motion that planetary healthcare health roadmap, sorry, and really break down the silos to go back again to what Dr. Thompson was saying. So that's what my hopes are for 2026 and beyond. So thanks, and pass it back to you, Courtney.
Yeah, thanks, JP. And I think that we're hearing kind of a similar theme through all of this. So, talking about breaking down silos in the actual implementation and work, all of the roadmap analysis that we've done, that Rice and I have done, has been about breaking down silos between people trying to do the work in different parts of the country so that we're coordinated and efficient and effective. And JP, I'm grateful that the funders have convened themselves as well to break down their silos and make sure that your work is as effective as possible. So I think the more we just really lean into reaching out, the better. And thank you for the work that you're doing, not only with us, but on a meta level to make sure that that work is gets as much done as possible. It's wonderful. So we're gonna now go to something that will definitely get a lot done. When Raisa and I were putting together the roadmap for planetary health for Canadian medical professionals, it became clear that our best federal lever are the accreditation standards. Like in this federated healthcare system, what gets people moving? Accreditation gets people moving. And John has been moving a lot at Accreditation Canada. Convened with Miles Sargent, I was honored and grateful to be part of a group that's already started to put planetary health and climate change and health into some standard related work. John, tell us what you've got going for 2026.
Thanks very much. So maybe I'll just tell people what we do, and then why tell us so you can understand how we can get going and how to coordinate everybody. So there's a couple of organizations here on my background here. One is Health Standards Organization, so that's what creates the standards and the framework in which some assessment manuals can be built. And then we have Accreditation Canada, which is sort of the assessment arm, which we go into organizations. We accredit every hospital in Canada, long-term care facilities, other type of facilities as well, health systems, and but we're also in 43 different countries around the world. I think what we do is very much evidence informed, focused on health and safety. And so I think we talked about this focus on quality and safety, and we talked about, I think, just at the beginning about Prime Minister Carney's comments about the world has changed, and I think that's a very precedent commentary. I'm very excited about, I'm very optimistic about things, and I think the first thing is calling things what they are, and I think that's the most important thing. Everybody getting on the same page, and I think. From a quality and safety perspective, we do have a focus on climate change. And our focus really is looking at what's mitigation and resiliency and creating resilient systems that can withstand perturbations and that we really have the ability to sort of mitigate issues as they arise. This is not just a nice to have, but this is what makes a healthy ecosystem, healthcare system, and great patient care. So I'm going to talk a bit about that. I think what also is important is there's this, I think, fallacy that green or decarbon, a lot of these things are more work, more money, more time. But what we're focused on and things that we've seen, it's actually less money, can save work, hours, waste. Waste is also money, like that goes out the door. All these things are savings, but not just in the moment, but in the future. And I think when we talk, I was looking at the UK report that Courtney was talking about, and what struck me is that we talk about these health ecosystems disasters or what have you. I have a slightly different perspective, and that's part of my job at HSO in strategy and things. Is I think I think from about 1980 to 2020, call it, we really have moved towards like a very monolithic culture approach, agriculture, supply chain, approaches to medicine, what have you. And that is actually a very fragile system because it's single points of failure. And when we see in ecosystems and ecology where you have diversity, it seems expensive at the beginning because from a perspective, but it's much more resilient, much more diverse, much more opportunistic. So let's talk about what that looks like. I personally, as I said, have a lot of hope. I think when you see perturbations in systems, they come back faster than expected, but also blended with a touch of realism. I think there's an older adage in medicine about, what it takes to get into a disease, about the time it takes to get out of something. And I think that can be applied to climate and ecosystems. So have a larger perspective. But I think it also has a perspective of people are feeling overwhelmed. There's so much to do. People are working in isolation, which we've heard. We want to build a community. And so how do we do that from someone that's patient facing right up to a leadership team to a health system? So I have a couple of things that we're working on and actions you can take, and how we can coordinate together. So it's really focused on specific action that's coordinated. So the first thing I think we heard Peter Drucker earlier talk about what gets measured, gets managed, and so measure, monitor, act, repeat. Very simple. So how do we do that? Well, we've just launched a pilot in the summer of last year, 2025. We're going to launch the final version of this tool. It's the Climate Action Maturity Assessment tool, in partnership with the Canadian Coalition of Green Healthcare. This is a short questionnaire that organizations can do all across Canada. We had 65 hospitals piloting it. So we're very optimistic what it'll be in the summer. It's in 10 sections, but it sort of gives you a pulse check where you are. It's not necessarily getting a lot of data in terms of, but where do you sit in all these different areas from within being a climate resilient system? That enables teams transparently to see where they are and help you make decisions. Where do you want to be? Where do you want to spend your precious resources of money and time, and implementation and training? What do you want to focus on? And then once you've focused on it, are you going to move the needle? Again, rinse, repeat. So that helps build the community, bringing people together transparently, organizations together transparently. So that's going to be launching in the summer. But also, what do we do with that information? Well, we have these things called standards. We have these things which are evidence informed. And then those also inform what we call required safety practices, which when you do accreditation are a must have. But within that, we have different types of standards. And climate is really being interwoven into our resiliency, all of our standards, our RSPs, and we are aligning that with the UN 17 sustainability goals. So there's some alignment there. There's lots of things happening. How do we get alignment? So, and I'm going to save one of these for a little later, what Courtney mentioned, but for example, our new medication management standard, how is medication climate change? Well, deprescribing is an example of some patients. I think Miles talks about being on 19 different prescriptions, not pills, prescriptions. And one inhaler is like driving 150 kilometers. So I think that's really key things we can do as healthcare professionals. Spring 2026, they're being released, implemented in 2027. New infection prevention and controls being implemented at the same release in 2026, the springtime implemented in 2027. Those are clean, even down to cleaning practices, how do we use water. But also important, which is coming up for modification, is our government's and leadership standard. And climate is being involved in that. Do you have a plan? How is governments and leadership? The leadership of your organizations, that is a foundational piece. And last not least, that I'm going to maybe talk about is the emergency and disaster management planning. We're updating that right now. We're soliciting people to be on the technical committee, and so we're incorporating this. We've heard about wildfires. We were in Hay River recently, where they've had 2 fires and a flood in 3 years. And evacuating all 3 times. The North has undergone needs tremendous resiliency because they're at that sort of edge of a lot of things happening, from extreme cold to extreme heat to extreme water. And those are just some examples. We hear that all around the world. India, water problems. Saudi Arabia, again, water. These things are not inconsequential, and not unique, you know. But I think we also recognize, and we talked about the Blenheim Health Action Plan at the beginning, where there's inequities with people that are most unable to meet their own needs independently are most vulnerable. And those vulnerable populations, that's our cultural safety and humility standards. We're weaving things into our looking at how people look at their supply chain because um, we were talking about Europe, Southeast Asia, those supply chains could get disrupted. What I think is important to recognize is in a military conflict, a lot of the things in the military conflict are very similar to what's going to happen in a disaster management type scenario. And so, if you think go back to my de-prescribing example, well, de-prescribing is important because it saves medication for the next person as well. And so this is all about building resilient supply chains. Those are all important things. We're dealing with why that supply chain got disrupted or not. And that is a much more robust approach to healthcare. So what does that mean? I think that we're creating tools to help measure. We're creating the framework in which to act, and we'll have examples like we'll have of other organizations that have been successful in implementing green strategies that have saved money, saved time. Um, and these are impacts that are not just about 1 year, 2 years, but could have a generational impact, just like we see when new therapies come to the market. Those are generational impacts. So that is the scale at which we're doing. So I have three things you can do uh, today. Because we're trying to enable people to not feel overwhelmed, how enable people to work together in a coordinated fashion. We talked about desflurane, people coming together like that. How can we come together and take action together to have an impact? So, easy thing to do, go to our HSO Accreditation Canada website, sign up for our standards, comment. Hey, like as they come up for review, we have to address every comment. Your feedback is important. One of our standards in long-term care, I think we had 15,000 comments. We have to read those all and address them all. So that's one easy way you and your teams can participate. The second thing is in the summertime, sign up for our green awareness, our green tool, and participate or encourage your organization to participate in the climate resiliency or climate tool so that you can assess where your organization is and benchmark against other organizations. I think that sense of competition, cooperation, I think is really important. And lastly, when you look at our standards, we're trying to align them with green and resiliency. Look to see how each one is again focused on how that can be incorporated into your green plans. Because taking something forward is one thing, helpful, an idea. Taking something forward in relevance to a standard is great, or a required safety practice, maybe even better. And that should hopefully get some attention. And an example of de-prescribing would be in a required safety practice. So that's what we're doing across the country, around the world, to try and coordinate what we're doing, gathering feedback, but also trying to build a community. So thank you.
It's awesome, John, and you really are. This is very much we don't want to call it a stick, but people do sit up straighter when the accreditation team comes to the hospital. And so it's helpful for us to know that this is coming, knowing what Adam and Jeff already pointed out, that our people are not prepped. And so I think we can use even just the story that this is happening to help get people to do the work of learning what they need to do. And so it actually starts to beget the question, okay, the standards are coming. How do we upskill the entire profession as quickly as possible in order to prepare for that in a kind of learning by doing way? And so that was really a lot of what we talked about at our national gathering, which I know you attended, John. And so thank you so much. you make me feel safer just being in the role that you're in. And I'm very grateful for that because I like feel safe. So I'm going to now turn to our partner in crime, one of the most efficient people I have ever met. And I learned recently she did an undergrad in math because she didn't want to give up that topic because she thought it was fun. And that explained a lot of things to me. Is Raisa Marks, who is a co-author on the roadmap and the mastermind behind a lot of what we did at the national conference.
Thanks, Courtney. Can you hear me okay?
Yeah.
Yeah, just to clarify, it was a minor in math. But
For
the
fun.
reasoning was correct. Hi, everyone. I'm happy to be joining you today from the traditional and unceded territories of the Gunyan people, also known as Montreal. And I'm going to talk about the gathering we had on October 6th. And I know some of you were there, which was great. And we did it's called Implementing the Roadmap for Planetary Health and Sustainable Health Systems. And the graphic you see on the screen right now, or did a second ago, is the kind of key graphic in that roadmap that talks about all the interrelated parts and how they fit together towards planetary health and sustainable health systems in Canada. So if you can go to my that slide. Great. So yeah, we had a meeting, or maybe you could call it a workshop. It really was a roll up your sleeves and get things done type of meeting on October 6th in Toronto. It was presented by the Canadian Medical Association and the Trachy Foundation. You heard from JP earlier in association with Power. We had about 100 people in attendance, many of whom you can see, although you probably can't distinguish anyone in that photo, but we had physicians, nurses, pharmacists, other healthcare professionals. We had representatives from nonprofit organizations and academia and foundations. And so it was just a great gathering of all these folks. If you go to the next slide, the objectives that we wanted to, or that we were working towards for that day, was celebrate planetary health progress in the context of the first National Day of Action on Planetary Health. It wasn't planned that way, but coincidentally, we ended up that October 6th was the first National Day of Action on Planetary Health. So that was very convenient for us. We wanted to generate alignment on engagement in and momentum for implementing the roadmap itself as a pathway to an efficient, effective response by the Canadian healthcare sector to the ecological emergency. We wanted to catalyze the implementation plan for key aspects of the roadmap, including a National Resource Center for Planetary Health, which I'll talk a little bit more about in a second. And we, of course, wanted to forefront collaboration, build relationships, and have some fun. And I'm happy to say that we did all of those things. So that was wonderful. So on the roadmap itself, we got into this exercise where people were talking about how is this going to work and what needs to happen for the roadmap to happen. And so these are just some kind of very high level things that came out of the conversation. So in terms of what's essential, collaboration is going to be essential. Funding is essential, and government attention and action. So these are all themes that you've heard already today during this webinar, and I'm sure in other spaces. The barriers, and it was quite interesting to see that the barriers people identified were kind of like the flip side of the essential items, which are silos. The opposite of collaboration is silos, and if people are stuck in their silos, that will be a barrier. And of course, lack of political will be a barrier as well. In terms of the recipe for success, so what we really want to have included in these conversations, we certainly want to be centering Indigenous voices. We want to have community engagement. And then there was some talk about the communications themselves being important and positive messaging, because we know that, people just shut down when they hear of all the bad news in the world. So the positive messaging is really an important piece. Things to keep in mind as we go through roadmap implementation is definitely there's time pressures amongst health professionals. As you all know, people have a lot to do, lots on their plates. And so rapid and efficient upskilling of these folks requires really clear structures and, more importantly, support as they do this. And then we just also need to be, of course, paying attention to the context that we're working in. So societal trends, such as the influence of the fossil fuel industry, misinformation and disinformation, like these are all kind of things that can be happening in the wider world that can affect how this is going. So to get to one of the key items in the roadmap, which is this Planetary Resource Center, National Resource Center for Planetary Health and Climate Resilient Low Carbon Healthcare. We did a show of hands at the end of the workshop, and there was near unanimity. Everyone had their hands up on the creation of the National Resource Center. But a key thing that we keep in mind is that there's a lot already going on. So there's people doing things nationally, provincially, locally, in all different aspects in all different ways. And we've got a snapshot of that at the October 6th meeting, but there's really even way more going on than we know about. And so coordination is really important, which avoids duplication of efforts. And we also heard from we sent out a follow-up survey afterwards, and one of the things that came out from that follow-up survey is that 2/3 of respondents indicated that they were interested and willing to help in some way to set up the center. So whether that was, they were willing to organize meetings or develop governance structures or develop partnerships. So anyway, there was just a lot of enthusiasm and excitement for this idea of setting up a National Resource Center as kind of one of the key first steps in moving forward on the roadmap. And then Courtney, if you can just go to my last slide. This is, we did a bit of a few kind of exercises, interactive exercises very quickly on October 6th. And one of the questions we asked was, what opportunities to deliver a healthy response to climate change make you the most excited? And you see right in the center there, the three things that came out the most were community, collaboration, and intersectoral collaboration. So I think that's kind of the key message I want to leave you with is collaboration is the key message. So I'll hand it back to you, Courtney.
Thanks, Raisa. And I think I added a picture of everybody with their hands up. And I think I love it that people were excited about this. And that was the vibe we got at the workshop. I think doing this by yourself in a silo, not only is ineffective, but it's lonely and it sucks. And what we found in that room was there's just so much positive energy. People were so excited to be there working together. So in a way, I think we need to look at the collaboration almost as a way to just make this life fun and help us cope. Like there's just going to be so many good aspects coming out of that. And so we're thinking that this would have sort of three main arms. So implementation, including curriculum development and, how to make sure everybody is doing the green scorecard that HSO and Canadian Coalition for Green Healthcare are developing, a policy arm, because we realize some of this needs sequencing. And so you do actually need somebody zooming out to look at the overall game board and figure out what should happen first, who should happen, and you need that to happen. And then data and research collection. I think we will eventually convince all of these governments to do the collecting, but I don't think we should wait for it because, an election can change everything. We saw that the Office of Climate and Health Equity in the US was doing awesome work. Election, they're gone. So to me, this is too important actually to leave in the hands of government, which might be a bit of a slightly odd thing to say, but I have spent too much time trying to keep an emerge open during wildfire season to feel good about an approach that doesn't really allow frontline providers to access the skills and tools and resources they need to do their job and keep people safe. And I think that we're the most motivated to do that. So a sector-owned center with really good academic affiliations and the ability to influence government in a way that makes the most out of what is required at a given moment is what we're aiming for. And so to that end, the next person I'd like to introduce is Dr. Marie Studer. So, we came out of this meeting and thought to ourselves, okay, so our next step is that we need to convene a process and, we'll need to write a grant to figure out who will lead that and convene that and get all of the people in a room, and it will be herding cats, and we will do bylaws and governance, and it will be worth it. And someone who has just done a tremendous amount of that is Dr. Marie Studer. So Marie, I'm going to let you introduce yourself. I've known Marie for I don't know how long, a decade now, through work on the Planetary Health Alliance Steering Committee. She's an absolutely wonderful person. And as it happens, she's moving to Canada, and we're very lucky that she is. So Marie, if you could introduce yourself.
Thank you so much, Courtney. I am absolutely humbled and honored to be here learning from all of you today and listening and getting my bearings because, as Courtney mentioned, I just moved to Ottawa from Washington, D.C., actually. And as you know, Ottawa is on the unceded traditional territory of the Algonquin Anishinaabe Nation. And I'm here to be with my husband's family, which is in the area. So grateful to be here for so many reasons. Courtney, maybe if you could, or somebody could just move the slide, it might be easier just to see. I have this slide and one more. I hold, as Courtney said just now, two positions. You can go back one. One is the senior advisor for the Planetary Health Alliance. And for those of you who don't know, the Alliance is the global backbone organization for the international community of practice of planetary health community. So it's been around for 10 years, and we have been building community across the world to work on planetary health, which, as you know, is a very holistic framework that looks at how human disruptions to all of the natural systems, so it's climate, biodiversity loss, land use change, ocean acidification, how those impact all dimensions of human health and well-being. But it's also a very solutions oriented field and social movement. So it's really looking about, okay, how do we create these societal transformations in order to ensure that we have a regenerative and thriving future? And we really take into consideration future generations in all of our work and try to think about not only the problem, but the solution as holistically and as interconnected as possible. So that's been my work. I worked with them for since 2020 as their executive director, and then also in 2023, 2024, moved with Dr. Sam Myers, the founder of Planetary Health Alliance, down to Johns Hopkins University from Harvard University to set up the cross-disciplinary or cross-university Johns Hopkins Institute for Planetary Health. And that was to do exactly what we heard earlier, is how do we train future leaders across all sectors, schools, dimensions, no matter whether you're an engineer or in the arts and sciences, or you're a medical practitioner. How do we train them through this lens of planetary health so that they can bring that knowledge, power, and their creativity to the work that they do while they're students, but also obviously as a professional career. So I'm enormously excited to think about this national resource center and how I might be able to support and help, and how do we also tap into the work that's been happening around the world. And so I just want to let us know we are not alone. This is a growing global movement. And there are some resources, through the Alliance already, and you can see we have roadmap and action plans and pledges and declarations, also from AFMC, but also from other places around the world. We have work in policy and education and research. And so how do we take that? And then we have examples from around the world. And I just put up the National Planetary Health Action Plan from Malaysia. That launched in November of 2025, just last year, and it is the first ever countrywide or national action plan for planetary health. And they bring together several, five or six of their ministries. Health security, or security is not mentioned directly in this as one of the ministries, but I do know that security is looking at this because they recognize absolutely that without stable natural systems and healthy and well population, there is no national security. So I think there's a lot of exciting stuff that we can bring to bear here. And I know we're running short, so Courtney, I'll stop there or prompt me with any questions.
Well, I just want to say how excited I am that you're here, because we don't want to be reinventing the wheel with a National Resource Center either. So the more I know that there's been tremendous amount of curriculum development done by the staff here, we want to be viewing this as a way for us to be as efficient in collaborating, not only within the country, but outside of the country. And there really could be no one better placed to help us do that than you. You've existed at the intersection of academia, policy, and influence for a long time. You know everyone, and you're a wonderful human. So I'm just really looking forward to working on this with you. And we're lucky at this moment in time because we have a decision maker who gets so much done as a senator that I can just barely keep up with her. So Dr. Rosa Galvez is she has a PhD in environmental engineering. She was the person who stewarded the Net Zero Act through the Senate. She has introduced the Climate Aligned Finance Act, and we're lucky that she's starting off 2026 with a real attention to planetary health and a transition to a well-being economy. And so we have 6 minutes left, and it's all for the senator. So Rosa, one of my heroes, take it away.
Thank you. Thank you so much, Courtney. And thank you to all of you and for this incredibly interesting conversation. I'm calling and I'm saying hello from my traditional territory in Quebec, where we live in the territory of the Abenaki, the Innu, the Wendat, Huron, and the Mi'kmaq. So happy to be calling from the territory in Quebec province. So I was in the COPs for the last 20 years. I've been going to the COPs, and sometimes, I'm more disappointed, and sometimes I'm more hopeful. This COP was very different. And civil society made it clear that climate ambition cannot be separated from rights, from human rights, from justice, from scientific and traditional knowledge evidence. I remember several indigenous delegates expressed frustration that the states continue to speak of partnership while approving projects that violate treaty obligations and free, prior, and informed consent. This has to change. I remember in particularly one youth people saying that, in this process, in these gatherings, it seems that we are negotiating our future as if it was negotiable, the future of next generations to come. Initially, I was participating in COP as a scientist and talking about the physics of the planet warming, but later on as a politician, as somebody that believed that the root of the polycrisis is the economic model, because we don't internalize pollution and we are an extractivist economy that causes so much damage to the environment and therefore to the health of everybody, the ecosystem, but also the humans. So I emphasize that climate change, biodiversity loss, and pollution, and you have said it already, we can no longer treat this as a separate issue. We have to stop treating these issues in silo. In the past, maybe there was some efficiency of doing that, but not anymore. These are all interconnected, and it's only a single systemic crisis that, in my eyes, are because the capitalist system, the extractivist model has attained a limit and can no longer serve to the evidence and the reality of today's world. We are living, of course, an unprecedented geopolitical, economic uncertainty, and I think that we have talked about the health, and we have talked about being holistic, and in that holistic view, we have absolutely to talk about the finances and the economical sector, because without money, without funds going into the right direction, we are not moving. And I'm sure I'm not telling you this nothing new, but that the health system in Canada and around the world is seen as an expense. It's an expense, and it's a huge expense, and they don't see it as an investment. They don't see it as society has a well-being society and a prosperous society and a healthy society. Most of my colleague politicians, the minute they hear about health, is an expense. And I can talk for hours about the transfers of funds from the federal to the provincial and all the problems that are there, but this is not the place. So yes, we have strategic assets. We have heard our prime minister going all over the world and selling, unfortunately, and it's not his fault, he is selling bitumen, he's selling LNG, and he's selling compact nuclear reactors, which doesn't exist yet in Canada, but this is what he is doing. And it's not his fault because this is what Canada has offered for centuries. So we have really to move into an economy, an industry that it leave all these extractive economy and move into a more interesting things, that the care economy, the artificial intelligence economy in education, in medicine, in health, the low carbon economy with renewable energy. And unfortunately, well, we have the perfect excuse is that Trump is there, and so he is the big obstacle to all our wishes and desires. But, let's be honest, this transition should have been a marathon. It should have started 50 years ago when we start saying, the scientists start saying that the planet was warming. And unfortunately, now we are at the clock is ticking and we are in a hurry, and this is like a sprint. And unfortunately, Canada is lagging in this situation. We don't have renewable energy to technology to sell to Europeans or to Asia. So what are we trying to sell is oil sands and LNG. But still, me too, I am an optimist, not because the situation is showing multiple optimist path, but it is by choice, because I think about future generations and we need to be optimists and we need to change what is in front of us. An infinite economic model in a finite resource planet is illogical, is incoherent with physics, and we have to change that. So Canadians leaders must act decisively, and you talked about, many of you, about the absence of the political will. And with this situation with the tariff and with Trump, is really even getting worse. But the solution to that is acting, and the solution to act is moving and at the different scales and pushing everything horizontally, because the silo approach has not worked. I remember looking at the budgets of the different departments and the different ministries, and it's not secret that the Minister of Environment was the poorest ministry in every country. Is the same, is the poorest, except maybe Singapore. I was recently there and I learned that they have lots of funding because in their modeling the high water, the ocean level is rising so fast that they don't have choice but to act. So I want to thank the collaboration that I'm having with Courtney and with Trevor Hancock, and we are trying to raise awareness among parliamentarians and the public about the importance of nature and societal well-being. We agree that the GDP is not in any way, in any manner, an indicator of well-being. And actually, I keep saying that since the war started in Ukraine, the GDP of Ukraine is increasing. So what does that tell about that? Together, this last week, we co-authored with Trevor and with Courtney an op-ed in the Hill Times called "Planetary Limits: Why Canada Next Nation Building Project Must Grounded in Reality." And I invite you to read that. So this collaboration is extremely important. And I know, again, profession has been working in silos. Engineers are there, doctors are there, lawyers are there, and we really need to bring ourselves together because there are multiple options. I'm so happy to say that there are now many, many countries that are giving legal personhood to ecosystems and to rivers and to parts of the Amazon, for example. And we have to follow that path, that example, in order to give the importance to the ecosystems in human health. And I think that it's becoming less and less abstract because we are talking more, but it is important. In legislation, in politics, we say that life is alive, is something that change with the time. And I think this is important that us in our profession, we tell people that changing the law, the purpose of the financial sector, for example, it is important. So with that, I will yield to you back, Kearney. Thank you so much.
Thanks so much, Rosa. And there are so few decision makers who have the scope of expertise and courage to be able to take something like this on. But I know that you're one of 7 engineers in your family, is it? There is a very deep well of IQ and EQ in this senator. And so, yeah, the more I've thought about it, looked at it from every different perspective, I think that taking a planetary health lens moving forwards with a clear societal outcome of long-term well-being for all is our best way to de-silo from the macro on down. And what that does is it lets us have a narrative around well-being at the personal level too. That helps people cope. It helps our organizations function better. And we can get into a virtuous cycle. The well-being literature is really clear about that. So we've come up at the end of our time. I want to just thank you so much for joining us and putting your brains together with us in service of long-term well-being for all. I'm deeply grateful for the work that you all do. At the end of EMWrap podcasts, they always say, what you do matters. We're trying to co-manage a planetary health emergency. And I want you to know that you're all part of a complex adaptive system at your node. What you do matters and has impacts that ripple out through the entire system. So thank you very much. I look forward to what we're going to be able to do together in 2026 and beyond. And I hope you have just a most wonderful day in the little part of the world that you're in right now.